surgeryandmedicine.com, your med school in your pocket.
In the next demonstration, I'm lucky enough to have been volunteered to have a nasogastric tube inserted, commonly called an NG tube. Here we've got a fine bore enteral feeding tube. There's different types of nasogastric tubes. This particular variety allows you to feed the patient through a tube that goes in through the nose into the stomach. Of course, whenever you're putting something in the nose down the throat, you have to be careful that you're going into the stomach and not into the lung. So we have a wire which can be picked up on X-ray so that we can see that it's definitely in my stomach and not in one of my lungs at the end of the procedure. There are other ways of testing to make sure that the NG tube is in the right place. For instance, you can aspirate gastric contents back from the tube, and if you test the pH, gastric contents are obviously acidic with a pH of around 2, whereas you'd be very concerned indeed if you managed to get a pH of 2 from somewhere in your lung. Now, I think you'll see through the entirety of this procedure that it's very, very uncomfortable. I'm not going to enjoy it, but for your learning needs, I'm going to put myself through this now. So, wish me luck.
Okay, so open up the tube, then you need to apply some aquagel liberally to the end.
You'll notice that we're both wearing yellow aprons and I'm holding a sick bowl because with stimulation of the vagal nerve as this tube goes in, it will cause a quite prolific gag reflex, which will be demonstrated shortly.
Once you're happy with the position of the patient, ask them to take a deep breath in. See if one of the nostrils is going to be easier to put the tube down. Okay, so I'm going to go for Reese's right nostril. I'm just going to ask him to sit back and lean right against the bed. Are you comfortable there?
Yes.
Okay. With the patient sitting back, rest your hand on the forehead and get the tube ready to be inserted. Have your glass of water ready. When I ask you to take a sip of the water. If you want me to stop at any point, just let me know. Okay. Insert the tube straight back. Get ready to take a sip of water. Take a sip of water now. Okay. Keep feeding the tube gently back. And stand clear of the patient. Keep feeding. You need to feed it to roughly about 60 centimetres on an adult male.
You better be learning something.
You can see these little indicators here, gives a measure of how far the tube's gone down. We're about a third of the way, Reese.
Lovely. So where are you going on holiday this year?
Okay. So once you're happy with the position of the tube, you then need to aspirate for stomach content.
Now, we're not going to actually do that now because I think that would make me sick. But what you do is use a 60ml syringe, attach it to the end of the tube, and you can aspirate stomach contents from that. You normally need to use the full force of the 60ml syringe to actually get any contents back, and then you use a pH strip to test the contents of the solution that you get back. Usually you can tell that it's stomach contents because it looks quite green, like the acid that you get from the stomach, and it's also got food particles in it.
Okay, the tubes come with a variety of devices and stickers to attach in position. So we just use one of these stickers, wrap it around the end of the tube and attach it onto Reese's nose, and that should hopefully hold it secure.
So we'll just demonstrate that just so you know exactly how to attach it. So you use that one at the top there, just sits over my nose here and wraps around the tube. What you'll also find is that there's a difference between the different type of stickers depending on where you work. So that wraps around the tube.
And fastens it securely into position.
And then you've got two smaller squares, one just to keep the tube out of the way, comes behind the ear, and you can just put the attachment just there to hold it out of the way, and another smaller sticker that just sticks over the top here just to provide a bit of extra support. You'll often find that patients will get quite annoyed with these tubes and end up pulling them out. And like we've said, if you don't aspirate the gastric contents back, you should get a chest x-ray, and that will show the tip of the tube, because there's the wire in the centre which will be radio opaque on the x-ray, so you can see if the wire is below the diaphragm or not. Now once you've got that x-ray, if you're happy that it's in the right place, you can actually take the wire portion out. So Charlie can just do that now. And no, that doesn't make it any more comfortable for the patient. So that's in place there. You have to cap it off, otherwise the gastric contents will go everywhere. And that's you done. And then you can use this NG tube. Now you need to make sure that it is in the right place. As we've said, you can measure, you can either sort of guesstimate how far the tube needs to go in, or you can crudely measure from the tip of the nose to the back of the angle of the jaw down to the zippy sternum, and that should give you an accurate estimation as to how far the tube needs to be. But somewhere between 40 and 60 centimetres is usually ample.